Hello, hello. Dr. Chelsea Eilets here. I'm a naturopath, doctor of classical Chinese medicine, and trained in functional medicine. I offer programs online as a functional health consultant. Today, I want to chat a little bit about energy. It's one of the biggest things that bring my clients to me, though most of the time, low energy is something that they've been pushing through for years. I don't know if you can relate to that, but it's not uncommon. If we feel a lack of vitality, have to hit the snooze multiple times, rely on coffee, rely on energy drinks, rely on those B vitamin supplements in order to get through the day, then this is for you. I like to bring up this as a topic for discussion because it kind of highlights the importance of following a strategy when we're addressing things about our health. So, if we just come right at it for something to support the adrenals, something to support the thyroid, we really miss the foundations of our health. One of the first things that we learn in naturopathic medical school is what we call the hierarchy of treatment, or the direction that we need to go in order to affect lasting change. And step number one in this is really removing obstacles to healing. Certain things can stand in the way, can prevent us from having those big shifts, those big lasting shifts that we really ultimately want to see. Big one is stress and stress management. A lot of us don't really have any plan in place for dealing with the stressors that are always inevitably going to come up in life, in our day. And it really is a disservice to not find a way to better regulate our nervous system. Other obstacles, toxic things, toxic exposures that we have in life. I was just talking with someone the other day who was simultaneously working as a jet mechanic, and then also getting into a lot of diet sodas, which we know have aspartame in them and can be neurotoxic. Eliminating those made such a big difference. So just using that example to sort of highlight where toxic things, these other things can be obstacles to our healing. And we really need to look at the lifestyle foundational pieces, like, if you're not getting enough sleep, for example, too, yet another way that we're bound to have low energy. So step number one, remove the obstacles. Step number two is feed your body. There are certain nutrients, vitamins, minerals, fatty acids that are essential. We call them essential because your body can't make them on your own, yet our function depends on them. So all of our essential vitamins, minerals, and fatty acids, if we're not eating them, our function is not if, but when, going to slowly decline, diminish until we start to notice really big symptoms in the body. And fatigue can be one of those early indicators that something's up, something's going on. Then next along this hierarchy of treatment, we start to actually give certain systems in the body nutritional supplements, herbs, even medications, and at the very highest part of this hierarchy would be interventions like surgery, something very invasive. Now, if we just we ignore all of these foundations, we skip supplements, we go just to okay, what's the medication, the drug? Again, more is available to us. There's so much more that, is it going to be the quick fix? No, you have to change things about your lifestyle, right? And some of us have the resistance to that. I'm hoping I'm talking to the people who are into making lifestyle changes to better their life and to show up more for themselves, their business, their family, for everything. But really, moving in this direction is what gives us those big lasting results, to where you're not relying on the next quick fix, not relying on the next cup of coffee in order to get through the day. But where to approach, do I have obstacles? Am I feeding myself? These are questions that sometimes can feel kind of complex to approach. And I go about it one of two ways in my practice, which I'm happy to share with you here. Step number one, I can treat you as if. So just moving through a program that gives you stress management techniques, systems and ways of living your life that are going to set you up for a higher degree of balance. Nutritional plans that meet all of your daily needs. and then starting to go through the systems basically from the outside in and giving supplemental support along the way, treating as if all of them had some degree of imbalance. Does it get as deep as what I'm about to share? No. But does it make massive, radical, amazing levels of change? Yes. Will it set you up for lasting results? Also, yes. Now, the second option that I offer to my clients, and I think is a very valid thing to look at, is approaching all of this with functional labs. So not going a step beyond the typical labs that we're all used to as our annual screening labs or wellness labs, like basically looking at your blood cells, looking at a basic metabolic panel, doing a little tiny check-in on the thyroid, looking at cholesterol and blood sugar. Those are the primary things that most MDs I see run. Really rare that I see anything more thorough. When you're able to get that, awesome. But taking it a bigger step further to really look at markers in the body that tell us how well is your adrenal function happening? What does your circadian rhythm really look like? What's going on at deeper level in your bloodstream? Nutrient status, more thorough look at your thyroid, and then also looking at things like your sex hormones, markers for your nutritional status, markers for how well your body's detoxing, and even hedging into functional genetics and looking at areas where maybe the body has just a greater need than what we would say is normal, average out there in the world. So if you're like, I'm treating as if, and I need to take things a step further, looking into functional labs, I think, is the best way to move forward with that. On that note, I'm happy to share a program that I've just recently launched called Ageless Gem. The link in my bio here on YouTube will guide you to my website where you can find all of the details of this amazing program. But essentially, this subscription-based program will tell my clients how to treat as if, really lay the foundations for their health, and then walk through the exact protocols that I use, or my best of protocols that are safe and effective without the lab testing, on what can we do to support all of the systems of the body. It's a subscription-based program, so if you find for any reason that it doesn't meet your satisfaction, you can cancel and you can opt out, though I don't think that you will. And if you decide at any point to upgrade, I take all of your subscription fee and apply it to the cost of an upgraded program. Again, link is in the bio. Go ahead and check it out. And again, I highly encourage you to take those foundations of your health very seriously, because they truly are the underpinnings of that amazing, good feeling that we're all looking for. Take care.